When more time when I get my dinner, I get 2 or 3 pieces of meat and I play that can't work. Me eat like say me eat half on rice. If we go back for more. If you try to starve me, I can cook. So if you know cook the right amount of food for give me to eat. Now I'm go behind her back, I'm going to the kitchen. I'm going to prepare something for myself. I'm enough cook. I had enough night. When me I go on my bed, me can't sleep.
In Office with Dr. Jevon Samuels.
Hey viewers, welcome to another episode of In Office. I am Dr. Jevon Samuels, and with me in office today is Mr. Taddesh Cato. Welcome to the show. Alright, so In Office is a program where we discuss life, sickness and death, and today discussing mainly a lifestyle disease which we call obesity. And my patient here, Mr. Cato, is an example of a person that is morbidly obese. So if obesity is basically a person have excess fat in their body, and the two main markers that we use to diagnose obesity, BMI, which is the body mass index, or the waist circumference. So for body mass index, it's normally the weight in kilograms divided by the height in meters square. So it's normally unit is kilograms per meter square. So for a normal BMI is between 18.5 and 25, and the BMI between 25 and 30 is normally classified as overweight. But any BMI that is greater than 30 is classified as obesity. And obesity have different classes as well. For male, the waist circumference, which is greater than 102 centimeters, is classified as obesity. And for females, a waist circumference which is greater than 85 centimeters is classified as obesity. Now, what are some of the risk factors for obesity? Main risk factors are lifestyle, behavioral issues, right? So you have overeating, poor diet, also sedentary lifestyle, so lack of activity, and poor habits overall. However, you do have a few medical causes that can put a person at increased risk of being obese, such as a disease that we call Cushing syndrome, some disease such as low thyroid function called hypothyroidism can put you at risk of increasing obesity, and also decreased growth hormone or decreased sex hormones as well can result in increasing obesity, risk of getting obesity. Now in terms of the complications are a wide list of complications that result from obesity when a person is obese. So it can put you at risk of getting a stroke, alright? It also put you at risk of getting a heart attack, also put you at risk of getting kidney failure. Right? It also put you at risk of getting obstructive sleep apnea, can put you at risk of getting hypertension, also put you at risk of getting diabetes and other lifestyle illnesses, example like osteoarthritis, a common side effect of being obese as well. Now in terms of the treatment, normally if it's a secondary medical cause, so the treatment would first tend to treat the underlying cause, whether it is low thyroid or Cushing syndrome from the steroid, would address those issues. However, it's prefer the patient to a dietitian to change their diet so they can eat more fruits and vegetables and decrease the excessive carbohydrates such as the rice, the flour, and the excessive brown provision as well, right? And also some persons may need an exercise regime to help with the weight loss. However, in some severe cases, they may have medical therapy in which we give patient medication to assist with weight loss. And finally, some persons may even require surgery, so they have barometric surgery on the stomach, which you have several different types. But for this program here today, we're not going to get into the surgical aspect of it. So, my guest here, Mr. Cato, welcome to the show once more, right? Now, you're obese, right? Earlier before the show, I calculated your BMI and I have a BMI of 47. Your waist circumference is 150, so you're classified as being morbidly obese. I just wanted to share with us, like, what were some of your eating habits when you were young?
Well,
Like for your breakfast, your lunch, and your dinner type of thing from you can remember as early as like primary school.
well, back in the days, I used to eat a lot. Ice cream, name it, pork, beef, chicken. I used to love food.
Love food.
Food was like a hobby to me. Food was like my best friend.
Okay.
Because whenever I really have no friend while I grow up.
Okay.
So the food and TV and etc.
Right.
Growing up, I never used to get a lot of lunch money, so I always get my lunch and bag. Kids at school would like must tease me.
Yes.
Come and buy lunch. I carry one food and like to say, I carry such a big plate of food and etc.
Oh, so you would take a big plate of food to school. So you would like what? So
Sure.
your mommy would cook in the morning
Or
have
cook
dinner.
before. Like she
And the
cook
night
in the
before.
night and then in the morning it already set.
Six.
She just
Okay.
warmed up. So because growing up it's hard.
Yes.
Sometimes if you find money for glass food, you know have it
Okay.
because the situation I mean something.
Alright.
So sometimes I want time to drink tea.
Okay.
But me always ensure that me have me lunch and bag and look for water, one juice.
Okay.
So you can keep eating home.
So what about the content of the lunch or the dinner that they used to eat, like in terms of the amounts?
Alright, if me eat like say me eat half on rice, if we go back for more. Sometimes
That's like at which age? Like at
like about
primary school,
about 9,
age 9, 10.
10.
Oh, alright.
Yeah.
You're eating a lot from that age.
Seriously.
Alright.
So basically when one time when I get my dinner, I get 2-3 pieces of meat and I play that can't work.
You have to get more. As in small pieces or large pieces.
That can't hold me, so because it can't hold me go back for more and I call it second.
Oh, see, your mom never used to tell like to limit the amount that they eat or
And that she always do, but it's impossible for me because if you try to starve me, I can't cook.
Oh.
So if you don't want to cook the right amount of food for give me to eat, now I'm go behind her back, I'm going to the kitchen. I'm going to prepare something for myself. I'm enough cook.
Oh, you love cook? Alright.
So because I cannot cook. Now I'm alone because she used to look days Jevon and something. Come home. And I buy like pound of chicken and 2 pound of chicken. Stew it down and cook some rice. Me eat like 2-3 times one time. And I know she shall come in later, she's hungry.
Okay.
So I left her dinner put on.
Okay.
Now look at brother in dangerous next up.
Since
He need more than me. And
Really?
he's slim.
and him slim, probably metabolic rate high. So in terms of like appearance on your mother's side of family and father's side of family, you actually have big body as well?
Yeah, I come out of a big breed.
Big breed. Okay.
So father side big, mother side big.
And your entire family just eat a lot. So you cook a big pot and you all eat a lot.
Yeah.
Alright. So what are some of the food that you normally eat though? Like your favorite?
You know fish, sliced fish, salmon, red snapper, kingfish, seafood, otherwise lobster, crab, shrimp.
Okay, so you love meat. So what about vegetables? You guys like eat like
Yes,
vegetables?
callaloo, cabbage, pak chow, but I'm not really a greens person.
Not a greens person.
But you have to eat it.
We don't really eat much of that.
No.
You like the meat. Alright, so you eat a lot of like pork, red meat, chicken, fish, the whole works. Alright.
That's cold.
So like in terms of this, since you become like in a teenager in high school, no, like what are some of like like normal like eat like one serving of rice or you actually eat a lot of rice?
Well, if I buy lunch and lunch just stand up to me standard, I buy one more.
So you eat 2 lunch at school? As in 2 big lunches? So you're bigger than the other kids at school?
Yes, sir.
So at no time when the kids come in calling them big sirs, you didn't consider to eat?
Then they call me big, so they call me massive.
So at no time it didn't click together they should try and limit the amount of food that they eat?
Sometimes, when I reach about 10th grade, we'll find a girlfriend, and because she don't love my food,
Yes.
she tell me, say, I need to lose weight. Around them time, they made up the rugby. I try to lose the weight, but it take a toll on me. A lot of stress with the control. Because a person like me, were born big,
Yes.
it is not easy to lose the weight like that. It's not like you were slim and you get big and you can run it off. Me, the muscle, the body fat, everything were in me where it come natural.
Oh, okay.
You understand? So for me, burn it. When you can burn 10 pounds in a 2 days, me I burn 10 pounds in a 1 week.
Okay.
You understand? So my natural fat now, it not burn so fast. Like how you burn your fat.
But at the same time, I understand that it won't burn as fast, but at the same time, I still have to start like eating greens and vegetables. Because if I can't really eat the meat and the heavy carbs like the rice and the flour and the ground provision.
What me used to do, me used to like drink callaloo juice with curcuma.
Okay.
Yeah, or pumpkin juice with little milk in it.
Yes.
So them things they used to keep me while me have the training. So more time I have training, I want to go back to
Okay.
well, me care for me, but mix already, I don't know say, I never eat nothing.
Okay.
So I drink that, it keep me, it full me.
And when you were in high school, you had any medical complications of obesity, like high blood pressure, diabetes?
And seizures of course.
And you get seizures. So when you're in high school, you start having seizures. Alright, so in terms of the high blood pressure, because then you will be a young man, so classify your high blood pressure as hypertension in the young. Did they do additional workup, blood work to test like the thyroid function, adrenal, and the ultrasound like kind of kidneys, etc.?
And the ultrasound, the CT scan, everything.
Everything were normal.
Everything.
So it would just be just come down to a lifestyle and eating.
Them doctors, them tell me say, my kidney failure come from the long-term blood pressure.
High blood pressure.
Because I have high blood pressure from me at 12 years old.
Okay.
And I never know that high blood pressure could mash up my kidney.
Oh, you didn't know that? So they didn't tell you the complications?
When me find out say my kidney them mash up, then what make me know say pressure could mash it up. I don't know.
Okay.
And then one tell me say also diabetes can mash up the kidney.
Yeah.
But I don't have diabetes. So I have high blood pressure. So Sometimes pressure is like 300.
The top, your systolic is 300? Oh, that's so serious, man. So you weren't taking your medication, but you probably need about 4 or 5 medication to control that pressure.
7 different pressure pills.
7?
And sometimes the pressure them still high. Yes, still a checking pressure. It was 189 over 116.
Even on the 7 pressure medication?
Yeah.
But remember that you have to decrease your salt intake as well.
Yes, man, but the thing is now, no one get to it. You see salt, and the salt raise up my pressure. Yes.
The weight?
Rage.
The what?
Rage.
Anger?
Ignorance.
Ignorance, okay.
Because I'm a very short-tempered person.
Okay.
It's when I get ignorant or get me off.
Yeah.
It's like it trigger something.
Okay.
Where it build up. Once I something to trigger, it's like me I climb a ladder and I can't stop.
Okay. So pressure just keep going up and up.
Keep rising.
Alright, so, and then you're telling me earlier as well that you actually develop obstructive sleep apnea and now you have to use a machine. So tell us about that.
So I was in the hospital about a month and a half ago. And I was lying down, I just couldn't breathe.
Just couldn't breathe.
Couldn't breathe. I was like drowning. You know, my own body weight, my own breathing, me just blast out, me just gone.
Okay.
So then put me through a process where, I forgot one clinic pulmonary.
Pulmonary. Where you got by national chest? Chest?
You.
Okay.
So them give me one test to do to see how much oxygen me can intake, how much oxygen me decrease,
Okay.
and how well me can take in air while sleeping in a deep sleep. Because a lot of nights, I tell you the truth, I had enough nights when me I go on my bed, me can't sleep.
Can't sleep.
It's like I'm on a US aircraft in a big ocean, a deep water, and I'm gonna just kick me overboard.
I'll say
I'm just drowning in a current. That's how I feel. It's like the weight of the water, you know?
Yeah.
Like, you know, when I'm on a roller boat,
Yes.
I saw the water of me. And it's like, maybe I'm a mind and play tricks for me or something, but it's all of me.
Okay.
And then me have a heart failure. The heart failure thing now is a next serious problem because my heart diaries, 2 weeks ago, my heart diaries are 171.
Okay.
Right? And then from bed rest, so me say me can't move, me must stay in a bed, lay down flat. I couldn't even lay down flat that, to tell you the truth. Me have to raise the bed a little bit to try to get a little breathing.
Okay.
Because my heart now just race. It a beat and it have the whole of my pulse in my body. I jump to it.
Now we're rapid.
Yeah.
Okay.
So it's very puzzling. I want to use the bathroom, I can't use the bathroom. I can't get up out of the bed to go use the bathroom. That's a problem for me.
Okay.
Because I'm not used to the bed thing.
Then, okay.
Them thing
Then
there.
easy without coming change and so forth. Alright, so that's several. So any other complications? What about the acid reflux? Girl.
Yeah.
You suffer from that as well?
Almost every day. And me have to take 2 tons. Sometimes, basically, them say me have to take 5,000 tons every day.
Okay.
And the tons I have is 1,000 each pill.
Okay.
Some take 5
Five of
hours a
them.
day.
Okay, alright.
Yeah.
Now, what about the arthritis, osteoarthritis? Because with that weight, I'm expecting your knees and your ankle to pain you from time to time.
Alright. And I can, before I can go on my bed, I have to rub my nerves in. Because I have a nerves problem, I take a pill named gabapentin.
Yes.
Yeah, for your nerves. 300 milligrams. My nerves problem, it intense. I'm telling you the truth, it's very intense.
Okay.
It really intense that sometimes I can't feel the foot. Sometimes the foot gets so numb that I can't even lift it up. I make one mistake with it. It starts some things where I can't control it.
Involuntary movement or
Yeah.
just okay.
It just start move off at one.
Okay.
Like it have a mind of itself.
Yes.
And it structured in my foot. Like them place that
Yes.
when you walk on them, it crack up. You hear the bone now. Click, 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 click.
Okay.
Like they're not firm.
They put you on a weight loss clinic?
Well,
Surgical clinic after your surgery?
let me tell you the truth. From day one, I did on dietitian. And it not work.
But and they obeying the diet that they give you to do and it still didn't work.
From the age of 3 years old, me as a dietitian from children. Till me left children hospital, I came to KPH, same thing. Came to university, same.
But if you're going to dietitian from when and you're going to be telling me that someday I eat 5 pounds of rice, you're complaining with the recommendation. No, but I can't say not working if you're not obeying the
Most of the things in my dietitian they tell me if you don't eat. I'm a favorite, you know.
Yeah, but then the dietitian part where
Cheese and milk and beef and they sit there, you can't just tell me to stop. There's something wrong.
the best friends. Alright, now let's go into the social aspect of life now. So you have a girlfriend?
Not right now.
Not right now.
Mm-mm.
So you have issues like when you have a girlfriend, any stigma associated with it or discrimination that because they are weight or not really?
Not really. I guess basically that's it. Maybe jealousy, friends come in between.
Okay.
But I'm not by the way, when I really outstanding to say me are the artist or the best side.
Yeah.
So if me say you make a move towards my girl and me believe say because if me have a girlfriend and she faithful to me, I'm not looking for her.
Okay.
If she not faithful to me and she go off and for her own to do things that gonna make me get upset, that gonna make me feel uncomfortable, now have peace of mind,
Yes.
stress out myself, just to prove a point. How easy thing, you can go on.
Okay, that's what I'm going.
I'm not going to take up one board and lick it down or shout out.
Hey, so what about the economics now? Okay, and dialysis and the last 2 patients are on this program that's on dialysis privately. The bill, monthly bill run them over 100,000 per month just for dialysis. I can just imagine. So what type of work you do to sustain those bills?
In a work.
In a work. There's family support that depends on.
Yeah, mostly strangers.
Strangers help you out.
Like friends, bypass, people from church.
Okay.
No one, not every time. But it's a rough road. Very rough road because it's not easy to find 15,000 even 2 times or 3 times a week is not an easy feat. Different from bus fare.
Food, living expense over. Before?
Yes.
The work you used to do?
Me used to do general construction.
General construction.
Over Portmore. Me used to work at Portmore company.
Like you do like the carpentry work or mason work or tiling?
Me used to do handcraft work before. But because the company I move over now, that get expanded.
Yes.
So the boss tell me say, like how me a carpenter and furniture maker.
Yes.
And me can do building too. Make me be building too.
Okay.
So me did the other thing, and the reason why I left the work there because complications happen.
Okay.
Them come in at the place and rob the place and then shoot the boss.
Oh, okay.
So me just left.
Okay. And so from that, you didn't try to get a different job or operate in a business or anything like that?
Yeah, me not try to figure out the business, but environment and the area I live.
You have feasible, practical, alright. So now, and you didn't try to get another job since the incident with that previous?
Me did have a next job, but the thing is far.
Oh, it's so far to travel?
Yeah, if you find the bus fare morning time, you know, easy.
Or that is
Me
the
work up Reddles Road, on the hill, Reddles Hill. And me have to find bus fare. So I take like say half a 3 taxi. One from Maxfield, half a 3. One from half a 3 got release and come off. But sometimes you catch a bus.
Okay.
You have hold a taxi. And the taxi stop now, it stop right out of Price Right. Me have hold a little minibus from Price Right, go up the hill.
Okay.
So 3 fare at a morning time.
Go and come on that 6
And
hour.
3 fare at go home.
So
You understand?
never practical in terms of the salary and
And
the
then
expense.
when me get paid, me I look upon if pay bill out tight, buy food out tight, bus fare Phoenix 2 weeks again. Me work.
Never work it. Alright.
So me just leave it.
Alright. So what are some of the short-term plans that you have now? I know you have several illnesses going on at once. Most of them most likely linked to the obesity, but other stuff as well, like the high blood pressure that cause most of them. But
migraine and
migraine. Alright. So that's one of the short-term plans in terms of the like weight loss program or to get a job or start a business. Any short-term plan that you're really working on now?
Since me admit in the hospital about 2 months ago, I lose almost 70 pounds.
70 pounds. Recently? So you previously were like
Me there like 460 something.
Oh, you're weighing 460? So you're actually slim now. So this is the slim version of you. Okay. Alright, so normally the final part of this program is normally if you have anything that you would like to tell the public, like if you're interested in getting help from anyone out there, that because this is a video that's going to go on the internet all over the world, so if you have any business that you want to help to start or any job to do or just in general if you want to just ask for any assistance, I can give you about 2 minutes for you to make a final statement.
Yes, I love some help with my dialysis.
Dialysis?
Yeah, because it's very rough with me, actually, because I 3 times a week they send me for the dialysis, and for me the dialysis 3 times a week, that's like every week 45,000, and for the month that's a lot for me, without food, without water, and then again it's a risk to me if I drink pipe water. We can't drink pipe water, it's only bottled water or purified water.
Okay.
So, for me, survive and live is hard. Very, very hard.
Okay.
You understand? I don't have nothing doing right now. In life, well, I really want to do something. Right? What I want to leave me and no one say, me have something to do.
Okay. Such as what? Such as what? Such as what? What are you thinking of doing?
When I go back in my furniture business, I know me good at something, I know me can make back my money.
Okay. Okay.
You know, me can make like door, chest or drawer, something easy. And I'm going on the dresser thing yet, go cut my glass and, you know,
Okay.
hurt myself. So, chest or drawer, door, bed and something. Can easily do.
Okay. Alright.
Yeah.
Alright, so thanks very much for coming, alright? So remember viewers, remember to like, subscribe, leave a comment on this video, and you can contact us at the number on the screen and in the display on this channel. Until next time, take care.
Be sure to subscribe for more informative contents on life, sickness, and death.